So Kadar made a claim that universal health care would not be beneficial to the American people. My name is Vincent. I'm going to be refuting this claim. Kadar made claims that the government would fail to successfully maintain the system. That number two, the universal health care would cause greater financial and physical pressure on everyone on the socioeconomic ladder. And number three, that public health care would lead to a decrease competition and would decrease the competition and ingenuity in the medical field. So my response to the first claim, again, which was that government would fail to successfully maintain the system, is that Kadar quoted David Mulhausen. He has a PhD in public policy claims, where he stated that the evidence clearly shows that the federal social programs are ineffective. Americans should not fear eliminating social programs, but my refute to that is that at the beginning of this same article, David states that finding an answer to whether universal health care would work is complicated. To answer the affirmative, federal social programs must ameliorate the social problems they target. In essence, social programs seek to improve human behaviors in ways that will make people better off. For example, social programs of the Great Society sought to eradicate the fundamental causes of poverty and provide an opportunity for the poor to join other Americans in prosperity. His second claim that universal health care would cause greater financial and physical pressure on everyone in the socioeconomic ladder. So Kadar made a claim that Norman Warner, a former health minister in the UK, stated that universal health care income taxes were averaging at 37% for the average worker, while it was 15.3 in the US. Well, I challenged that evidence, whereas in 2013, the Organization for Economic Cooperation and Development, also known as the OECD, stated that the United Kingdom, another country that has the right to health care, managed to provide health care to all citizens while spending just 41.5% that the US did per capita, and that the United Kingdom spent $3,364 on total healthcare spending per capita versus $9,000 that the U.S. spent. So to counterclaim Kadar's argument, according to the American Medical Association, on average, private health insurance plans spend 11.7% of premiums on administrative costs versus the 6.3% by public health programs. Also, that a study by the American Journal of Public Health stated that Canada, another country that provides universal health care, spends half as much per capita on health care as the United States. Another report in 2012 from the Consumer Report says that paying for health care is the top financial program for the U.S. For U.S. households. So Kadar's third statement that public health care would lead to a decreased competition and ingenuity in the medical field, whereas Kadar quoted Kenneth Thrope, a professor and chair of the Department of Health Policy and Management at Emory University, stating that we have benefited from having the best and usually the earliest access to the latest medical technologies and innovations. In large part, this is because they were discovered and developed and produced here in America. Well, that statistic is true. There's nothing to refute that America is the top leading country. However, there is evidence to state that according to Laura Koshini and Carrie Strong of the Economics Development in a Global Environment, states that the general standards of health, such as life expectancy and infant mortality, are not as high as those in countries with public health care. Americans do not fare better and often fare worse than citizens in countries which spend substantially less on health care. Also, according to the CIA World Fact Book in 2014, the U.S. had an average of 6.7 deaths for every 1,000 live births, and an average of life expectancy of 79 years old. whereas in comparison to, again, the United Kingdom, where they have an infant mortality rate of 4.4 and a life expectancy of 80 years old. And then in Japan, they had an infant mortality rate of 2 and a life expectancy of 84. In other words, just because we have the modern technology doesn't mean that we put it into practice, whereas other countries that have universal health care do have a higher infant mortality and a higher life expectancy rate. So, in conclusion, there is evidence to prove that universal health care can benefit the American people.
All right, structurally everything is easy to follow. There's a good preview. You signpost as you get to each of those points, so there's not a problem. On the first point, you summarize the advocate's evidence quite a bit, and basically it comes down to, though you present a long quote talking about how we have to address the social systems and all that sort of thing, and I still don't know what that means in regard to that first argument. It's not very clear. It sounded like at first you were saying that the advocate was quoting something out of context, but then later on it sounds like it's really just the same sources saying this is a complex problem. That doesn't necessarily diminish the claim that the advocate was making on that first point, so I'm not sure that you've accomplished much with that first response. On the second response, there's not really a lot of analysis of the advocate's argument and evidence. There's primarily counterclaim on all of this. And I think you do a good job on counterclaims on both the second and the third point, talking about what the amount of spending is, per capita especially. And, for example, on the third point with the death rates and the longevity issues, doing a contrast. Again, I think that there's not enough analysis of what the advocate argued on these particular points, but when you have contradictory claims on some of the same issues, that gives you some grounds for challenging that position. I think it would be a little bit stronger if you could suggest that there were problems with the advocate's evidence or reasoning in some way, and then explain why yours is superior. I just get other evidence, and you need to do a little bit more contrasting for us. All right, thank you.